Well, good morning. My name is Maria Royall. I'm a benefits assistant here at WSU Human Resource Services, and I am here to give you a quick overview of the open enrollment period, which is coming up for the full month of November. I will move kind of fast through this, but give you just a quick update of upcoming plan changes, anything you need to know that's different about this year's open enrollment, and also just a general overview of what changes you can make. That URL on the screen there, hrs.wsu.edu/open-enrollment, is a great resource for you to use. That website we keep updated with every communication that we send is a copy saved there. All of the forms that you can use to make changes, and also all of the online portals will be linked to make online changes as well. So if you want to open up that website, it doesn't have the forms and portals live right now because they're not available until November 1st. But that is a very helpful resource. You can also find it just by going to the hrs.wsu.edu homepage, and right underneath the COVID information is a big box for open enrollment. So for 2021, PEBB open enrollment, PEBB is Public Employees Benefits Board. That's who you get your benefits package through. Basically, annual open enrollment is the month of November every year for a January 1st effective date for all changes. So during the month of November, which starts on Sunday, for a January 1st, 2021 effective date, you can make the following changes or updates to your coverage. You can add, change, or waive your medical or dental plan for any reason. If you're on a medical or dental plan that's not working well for you, you can try a different one during open enrollment for a January effective date. If you're waiving your medical coverage, you do have to have other group or employer-based coverage, Medicare or TRICARE, meaning you can't waive to simply not have insurance or to go on to Apple Health. Those are basically the only non-options. You can add or waive dependents. If you're waiving a dependent, of course, they do have to have other coverage. And if you're adding someone, we need to have dependent verification. More on that in just a minute. And then if you're permanently removing someone, meaning maybe they're no longer eligible, like you got a divorce, that has to be done by hard copy form to trigger their COBRA paperwork being sent to them for a self-pay coverage option. During November, you can also attest to the spouse or state registered domestic partner premium surcharge. If you're not familiar with this, basically, if you're putting a spouse or domestic partner on your coverage and they have waived other employer-based coverage that's comparable to what's offered through WSU, to be on your plan, the state can add $50 onto your onto your premiums every month. Some people need to attest to this every year. If you are one of those people, you will get messages and notifications directly from the healthcare authority. But basically, if you have to reattest every year, that has to be done during open enrollment, or that surcharge will be automatically added to your premiums. And then if you are interested in having a flexible spending arrangement, FSA, or Dependent Care Assistance Program, DCAP account for 2021, you do need to enroll during November to have it for the full 2021 plan year. The only other time you're able to pick up these benefits or accounts for FSA or DCAP is if you are to have a special open enrollment event, like the birth of a new child. If that does happen, you have kind of your own special window to pick up these benefits. Otherwise, you do have to enroll during November. How to enroll. So in a normal year, we always encourage online changes whenever they are possible. It's much faster. There's no possibility that paperwork is lost, and you do get to print and save an automatic confirmation that your changes were recorded. So there's a couple of major benefits to doing online changes. However, this year, especially because of the pandemic and social distancing, online changes are strongly, strongly encouraged. So for medical and dental, the healthcare authority has what's called My Account, which is their online portal. There are a handful of things you can do year round, but you can also make a lot of your changes during open enrollment online. And again, they're immediately recorded and accepted. You can change or waive your medical or dental plan. You can add or waive dependents onto your plans as long as they have previously been on your plan. If they are a brand new dependent that you've never covered before, we do need a paper form for that so that we can verify that they are your child with something like a birth certificate. And you can also attest to the spouse or state registered domestic partner premium surcharge on PEBB My Account. This is very easy. You just kind of click through, change the boxes to the coverage you want, and then it takes, a minute or two, click submit, and you're all good to go. For the FSA and DCAP, you can also do that online. That is just through the Navia Benefit Solutions portal, which is peb.naviabenefits.com. You can enroll or re-enroll. Either way, it doesn't matter if you've had these benefits in the past. So again, both really strong options. If you do need to add someone for the first time to your coverage, if you're removing someone permanently, they will never go back on your coverage again. Or if you just don't have access to the online options, we will have forms available for download at the open enrollment website, hrs.wsu.edu/open-enrollment. Those become available on November 1st, which is a Sunday. I don't work on Sundays, but I will have them available first thing in the morning on November 2nd, which is Monday. However, the online portals will become available on Sunday, November 1st, if you want to get those changes done as quickly as possible. This is just a quick screenshot of the My Account portal to show you what you should be looking for. I also like on the right-hand side, it tells you actions you can take year-round using this portal. Some reasons you might want to have an account set up. You can view your medical and dental coverage anytime, including who's covered on your plans. View your employer-paid life and AD&D insurance and long-term disability. You can download a statement of insurance at any time, which can be helpful for a number of reasons. You can view your premium surcharge attestations, and also year-round make changes to your tobacco use surcharge attestation if your tobacco use status does change. That can be changed at any time through the My Account portal year-round. And then down below, just a reminder of actions you can take during open enrollment only: making changes to your medical and dental, attesting to the spousal surcharge, removing medical or dental for your dependents, and waiving coverage for yourself. This is what the Navia Benefit Solutions portal looks like. Those tabs across the top are helpful. It'll tell you benefits we offer. Enrollment is if you're enrolling for the first time. Forms, if you need to download a form and submit a hard copy, that's also fine. This is what it looks like throughout the year, but this will change and have open enrollment kind of more in the forefront once November 1st comes around. As mentioned, we are continuing to practice social distancing in the Human Resource Services office. Typically, we have a lot of people come by to do paper forms. However, that is a kind of a last option. We highly encourage people to use the no contact submission options wherever possible. Again, remember, the portals are a great option if that works for the changes you're hoping to make. However, if you do need to download and submit a hard copy form, there are a lot of options. You can fax to that number on the screen. Again, this will also all be on the open enrollment website as well, so you don't have to remember this. You can email any of your forms to hrs.benefits@wsu.edu as long as you leave social security numbers off and put your WSU ID on instead for security. You can use good old-fashioned USPS mail to the address on the screen. And you can also use campus mail if you're still reporting to a physical work location. That is a fine option, just as long as you're sure your forms can make it to HRS Pullman by Monday, November 30th. Occasionally, we also have people who are hard of hearing or vision impaired who do need to come into the office. We are happy to accommodate. Again, just wherever possible, we are encouraging people to make changes online and by no contact submission. Along with your forms, or if you're sending them by email, you can include it in the body of the email. Include just a brief note telling us what changes you are hoping to make in open enrollment. This is helpful because sometimes just looking at the forms that we received, it's not immediately obvious what changes are actually being made to your coverage. And sometimes people don't fill out the forms right. They're maybe doing something that they don't intend to do. So it's always helpful to know, I'm removing my children from my coverage. I'm keeping everything the same, but changing my medical plan. Just give us a quick note telling us what you're hoping to do so we can make sure that we are giving you the best service possible there. Here is a quick screenshot of the premiums, the changes from 2020 to 2021. Nothing extremely major. Most plans have slight increases year to year. Some of them might save you $1 or $2. I'll take it. But if you're someone that the amount you pay month to month is a major determinant for you, and you see that your prices have gone up, you may be able to just look on the screen and see what other plans are within your price range and make a switch accordingly. I will just leave this up for just a minute for you to take a look over, but again, nothing, no real extreme changes to the premium rates. As a reminder, premiums are taken out pre-tax as a default from your pay. And they are also taken out twice per month. So the amount you see on the screen, you would expect to see half of that come out of each paycheck you receive. All right. So there are a few changes to the medical plans. Nothing extremely significant, but I will let you know the information that we've received. All plans, all Uniform and Kaiser, Washington, Kaiser Northwest plans across the board, all plans will now cover one hearing instrument per ear every 5 years at no cost to the member. The one exception is if you're on a high deductible CDHP. This will be after your deductible is met. If you haven't met your deductible yet, then you will be on the hook for some of these costs. Providers may not balance bill you for this service, meaning that's basically just a provision that you're not charged above and beyond. I mean, if it's supposed to be $0, that means you won't be charged. But balance billing is a practice that's kind of becoming illegal because it's bringing in providers that are out of network and you're charged for the difference, even though you did everything you were supposed to do. That cannot happen. So hearing instruments are essentially covered in full every 5 years. Uniform Medical Plan has a couple of changes for vision coverage. They are now offering their vision coverage through VSP, Vision Service Plan providers. And coverage for the hardware will also vary depending on where you are purchasing. Some of the big box stores like Costco can offer hardware for much less than $150, which is your typical 2-year hardware benefit. And so we don't have much detail on this, but I'm assuming that means that they will cover less in terms of a hardware benefit if you purchase from some place that offers glasses or contacts for much cheaper than $150. If you have specific questions about that, or if you're concerned about your vision provider being within network, I just suggest you reach out to Uniform Medical Plan and ask them if they can give you any more detail on that. UMP is adding a couple of counties and providers to their Puget Sound High Value Network Plan. So Chelan and Douglas counties are being added to that network coverage area. They're adding the Everett Clinic to their provider network, and this is actually effective as of October 2020, not January 1st. And they're also adding Confluence Health, but that one is as of January 1st. Uniform Medical Plan is also adding a brand new medical plan called UMP Select. I'll show you a little bit more of the breakdown on the next screen, I believe. But this is kind of a mid-range option. We have things like Uniform Classic, which are high premiums but really strong coverage. We have the CDHPs, which are very low monthly premiums, but a lot higher deductible. And UMP Select is pretty much smack dab in the middle of those two. So this plan has the same covered services and provider networks as UMP Classic, but a little bit of difference in deductibles and coinsurance. You can learn more on the UMP website, which can be found through hrs.wsu.edu, but I will show you more in just a second. So comparing the uniform plans, the premiums on the screen, that's the breakdown between individual coverage, $105, individual plus spouse, $220, Individual plus children, no spouse, is $184, and then $299 is full family coverage. So those 4 premium rates, that's the breakdown there. So you'll see Classic has the highest monthly premiums. CDHP, as mentioned, is on the low end, and Select is in the middle. You'll also see that same kind of range for the deductible. So Classic has the low deductible, the CDHP is high, and Select is right in the middle. There's a prescription deductible for these plans. You'll see just a slight variation in the coverage. The CDHP and Classic will cover you at 85%, and you pay 15% for received services after you've met your deductible. And Select is just a little bit lower at covering you for 80%. The Classic and Select, you can use an FSA with, which is the flexible spending arrangement, a front-loaded spending account that can cover your medical costs and then you pay back throughout the year. And the CDHP is connected with a health savings account, which is not front-loaded, but WSU makes contributions on a monthly basis into that account for you. And you can also elect to put your own money into that account if you choose, but that's entirely optional. By and large, you kind of get to choose as the person purchasing a healthcare plan if you would rather pay more money on a month-to-month basis and have stronger coverage once you receive services, or if you would like to save money month to month on your premiums, but pay more when you do need to see someone. That's kind of the trade-off. Higher premiums, lower deductible, low premiums, high deductible. So if you're someone who has a lot of regular recurring medical expenses, it's probably going to feel better to pay more month to month and then have better coverage once you go see your providers. If you're someone that can handle a little bit of risk, save money month to month, but be willing to pay more when something comes up, but it's not as consistent, then the CDHP can be a good option for you. And Select, as mentioned, is kind of in the middle. If you want to pay a little bit more, be covered a little bit better, that deductible is about half of what you would see on the CDHP. That will be an option for you as of January 1st. For the medical savings plans, both FSA and HSA are increasing the annual limits. So for FSA, in 2020, you could choose up to $2,700 for your flexible spending arrangement. That's going up to $2,750 in 2021. And then for the HSA, the maximum that you can contribute into an account is also going up. For employee-only coverage, it's increasing to $3,600 over the course of the year. And for family, that's going up to $7,200. For HSA, the election limits include what WSU contributes, which is $700 over the course of the year for an individual and $1,400 over the course of the year for family coverage. That includes any money that you choose to put into your account. Again, that's entirely optional. And it includes the $125 wellness incentive, which I will come back to in just a couple of slides as well. This year during open enrollment, MetLife is offering a one-time opportunity to enroll in supplemental life insurance or increase your coverage. It's really what they're offering is not an open enrollment for life insurance, but it's a simplified process. Instead of going through a little bit longer of a health questionnaire, they're simplifying it to just 5 health questions that you can answer, and using that, they can determine whether or not you'll be approved for enrolling or increasing that coverage. This opportunity is unique. This won't happen again, and it's only during the month of November. As of today, October 29th, that is all the information I have about this process. If you have more questions about it, you can contact MetLife and see if they will tell you more, or you can just stay tuned. And as of November 1st, I will have the default option is to try to do that questionnaire through the MetLife My Benefits portal. However, there is a form that we can give you if that portal doesn't work. So keep an eye out if that's something that you're interested in doing, or maybe if, I don't know if you've been denied for trying to enroll or increase your life insurance in the past, this can be a really good option for you. So more information will be provided as soon as we receive it, but that is all I know for the time being. And Smart Health. So I mentioned this during the HSA portion. But let this be just a reminder to you, if you are eligible for benefits and if you have your insurance through WSU, you have the option to earn $125 towards your healthcare costs by participating in Smart Health. That URL at the bottom of the screen can take you there. If you haven't registered, you can still earn all your points for your 2021 incentive if you start now. However, if you also started earlier in the year and just haven't thought about it in a while, let this be your reminder to go earn those points. You have until the end of November this year. That's an extension from previous years. So you do have time to go in and earn those points. If you hit the 2,000 point threshold by the end of November, you receive $125 either as a reduction in your deductible if you're on a traditional plan like Classic Value Plus, or if you're in a high deductible CDHP plan, that $125 is an extra deposit into your health savings account in January. When you enroll in Smart Health, the first thing you do is take a well-being assessment. As soon as you finish that, you earn 800 points towards the 2,000 you need to earn, and you get a $25 Amazon gift card. So if nothing else, we always encourage people to go take that well-being assessment, get their gift card, but also there's $125 on the line. So go sign in, do what you can to earn points. There are tons of ways to earn points. It's, again, totally possible to earn all of your points if you haven't started yet. But Smart Health is a great program and we encourage you to go take advantage of it. So that was kind of a, flyby bird's eye view of Open Enrollment 2021. If you have more questions, feel free to contact our office. There's our phone number and email on the screen. But again, that website that I put on the first screen, or just go to hrs.wsu.edu and click the Open Enrollment banner. All the information we can possibly provide is included on that website. So go check it out. Let us know if you have questions and get ready to make your changes as of November 1st. Thank you for attending.